Hi, welcome. I'm trying to learn medicine. Today, acrocyanosis, and after we've done what we're gonna do wrist training. And if you participate in the wrist training, then it's at your own risk, and we're talking about diseases. Now, acrocyanosis, I think I heard reference to it oftentimes as just cyanosis, not acrocyanosis, but we're gonna do it like that now. And again, this is not any medical advice or anything, we're just reading what is in here. Acrocyanosis, that is a harmless but persistent deficiency in the circulation of the extremities, hands, fingers, feet, and toes. So the extremities, I was saying, is firstly hands, fingers, feet, and toes of young women to be right. I heard the term cyanosis quite often. So not acrocyanosis, but cyanosis. So it might be the same, just shortened, cyanosis. And cyanosis is something which other people apart from women also have. Okay, acrocyanosis, that is something which young women have, that is deficiency in blood circulation at the extremities. Symptoms: there is no pain, but the fingers and hands are always cold and blue. I wouldn't say always cold and blue, but okay, they are oftentimes cold and blue, the fingers and the hands. Duration: a persistent complaint, but as the patient gets older, the symptoms abate. Okay. It is had by young women, but when we get older, it gets a bit better. Causes: the blood vessels of the hands and feet are unusually sensitive to cold. The reason for this is unknown. That is interesting. It is that they are too sensitive, the blood vessels. So the problem is completely where that is. Where it's part of the blood system, one could think it's way more complex. That is an interesting thought. Maybe I had never thought of it. If it's now a bit outdated or not, it's 40 years old, what is written here, but whether it's now outdated or not, the idea that the problem with cyanosis, or maybe acrocyanosis is a specific type of cyanosis, of not properly blood circulation in one part of the body, could be that where the sensors are wrong, not in the nervous system somewhere, not something in the brain with some how to pilot all that, not something at the heart or the whole blood vessels, just with the, and we're saying what are we saying? The blood vessels at the hand. So I'm saying the blood vessels, not the nerves. That's also interesting. What measures cold? Not the blood vessels themselves. Whatever. That is a very interesting thought. Treatment in the home: keep the fingers and hands warm. When to consult a doctor if a condition persists and worries you. So if there's worry about the cold and blue hands and feet, then to consult a doctor. And also if a condition stays over a longer time. What the doctor might do: make sure it is nothing more serious. So to make sure that it's nothing more serious, prevention: protect hands from cold, and probably also the feet, don't go barefoot out in the snow. So try to keep the hands warm and the feet. Outlook: good, but the condition will persist for several years. Okay. We're going to read on with the next two parts. Maybe we're going to help us if maybe we could also go to science to find it out. I rather have the idea that it is that we're different. Just the idea that there are different types of cyanosis, and not just people who have more or less cyanosis. But imagine the idea that there are actually completely different types of cyanosis, so of less blood circulation to one part of the body. A part of ischemia or other things. So acromegalia is the next thing. A disease in which the skin thickens and the hands, also completely something else. Let's read it. A disease in which the skin thickens and the hands, feet, and face, particularly the lower jaw, enlarge. It is the result of overproduction of growth hormone by the pituitary. That is acromegalia. Okay, I heard of it. It's the result of overproduction of growth hormone by the pituitary gland, which lies in the brain. Okay, the pituitary gland is in the brain. We wondered about it in biology. It was said that the pituitary glands are sending out antidiuretic hormone to the kidneys, and that makes the kidneys produce either more or less, we haven't understood it, urine. The pituitary glands are in the brain. A benign, non-cancerous tumor of the gland causes the excess production. Treatment consists of destroying the tumor by radiotherapy or by the removal of the gland. Acromegalia occurs after the age at which normal growth stops. Excessive production of growth hormone in children produces a different condition, gigantism. Now, I thought it was just some plus or some additional information to acrocyanosis. Now, that is a completely different thing. And the chapter is actually very short. I heard quite a lot about acromyalgia and also about gigantism. Maybe that's completely coincidental that I heard quite a lot about that one disease. But we're going to do acromyalgia in detail in the next part. Now a little back to the acrocyanosis. We're not going to look up now if there is a cyanosis as a separate thing. But first, what it is. So cold extremities, young women do it have, and painless. I wouldn't call it in an absolute sense painless if I count that as a form of pain, especially if it is a year long. Okay, it's more or less, they mean medical sense painless. But maybe when there's a category would be interesting, because cold hands is a form of pain. I'm not go out into this now and try it. No, this is not an advice that you go out and get cold hands. Duration. So because it's that the blood vessels are unusually sensitive, there has to be a little more to it. But it could be completely mechanically explained. It would be really interesting if it is really a problem just at the blood vessels, and just a basically mechanical reason, just wrong measuring of temperature, and that the blood vessels are doing good. And just to keep the hands warm. If it worries or persists, then consult a doctor. And the conditions take some years, but it gets better over time, and it's a good outlook. Now we're taking some ideas with us from that, a part of all the information. But it can be possible that a problem with the blood circulation can happen maybe just at the regional problem, and not at the whole blood circulation or the brain. And that there at least the idea that there could be completely different types of cyanosis. One of them could be then acrocyanosis. Now, if you go here for medicine, then go directly to the next part. Maybe we get some answers to these questions over time. We will do now the Wristtraining. If you participate in the Wristtraining, then it's that idea honest. Good, and same as then, arms next to us, hands on the fists, and we're doing the spotlight. We're bringing the fists down and up. And again down and up, and then a couple of times. And now the flashlight fists, and then to the inside. And then the outside. Maybe we're not going to do it from that here because I probably know what is it. I said you're going to do it. And now the next exercise. The magician, flat hands went to the inside. And to the outside. And now flat hands and bring them up and down the pancake flipper. And now we're doing T-Rex in the morning. Flat hands out and bring them down and down. And now the T-Rex in the gym. If you want to do it without a tennis ball, or you do it without a tennis ball, then just make a strong fist. And release. And press again. Release. And press again. Release. And now switching. Press again. And release. Press again. Release. and press again. Release. Next exercise, the cautious big bang. Place your fingertips of one hand on top of the fingernails of the other hand. Press a bit, okay, opening and closing. Now we're having 3 rules. The first rule is that we stop immediately as soon as there's pain. The second rule is that we go only as fast as we can go with a little bit of effort. We're changing. And the third rule is that we're not overdoing it. So if you want to take a break, then do it. We just want to strengthen, not to exhaust. And now, the crab anxious to a fever. Next to us, you can skip this exercise if you want to take a break. And press the fist, bring the fist into flexion, and press a bit against. Pull from the outside. And press a bit from the top. And over to the other side. Hands from to the fist, into flexion, press against it. Pull from the outside. Press on top. Now with 50 days is new synthes director. Fists and open them and close them. And now bicycle bridge. Flat hands, bend them at the knuckles and open again. Bend again at the knuckles. Open the last time. Now the frog testing the water temperature. You can skip this exercise if you want to take a break. Hands down with flat fingers and up with strong fists. Again down, flat fingers. And up strong fists. And down, flat fingers. Up strong fists. Now the claw. Make flat hands and then make claws. And up again. Again, claws. Hold it. Open. Close. Hold it. Next exercise. Take the arms in. Strong fists into flexion. Again, out the arms. Wrists into extensions with flat fingers. Again, in. Strong fists flexion. Out extension flat fingers. In. Strong fists flexion. Out extension flat fingers. Again, in. Strong fists flexion. Out extension flat fingers. And we're ending here. And now we ice flat hand. Bend it at the knuckles and press on all 4 fingers. Hold again. Now the other hand. Bend it at the knuckles and press on all 4 fingers. And over again. And last exercise, we unfold your good boosters. Go to stable stance. Long arms, strong fists, and bring these strong fists to the inside of the flexion. And to the outside of the extension. The flat fingers. Inside strong fist flexion. Outside extended flat fingers. Again to the inside strong fist flexion. And outside extended wrists flat fingers. And we're ending again here. Now we're going with water pressure over the middle part of the lower. And on the other side. Now with also this chain. I thank you very much and until next time.